Wrapping up the week, we get perspectives on how COVID-19 is affecting Arizona's hospitals. Sorry for the confusion there, Dr. Ross Goldberg. Always good to see you. President of the Arizona Medical Association and District Medical Group, Vice Chair of Surgery. Dr. Goldberg, let's start with the schools, shall we? In your medical opinion, and I don't want to get into policy because I know all the districts are the ones who make these decisions. Is it safe to have our kids in schools with the numbers that we've been seeing?
Well, good morning, as always. And we talked about this before, right? We need to be adapting to what the data shows us. As numbers go up, we have to be careful about having large groups congregate, even with all the social distancing and mask wearing and hand washing. So I think, again, you want to use the data to guide you on what you need to do. I have no problem with school districts looking at their data, being concerned, and altering their plans based on what they're seeing with the numbers.
So, I mean, how many documented cases, and I know it's something like 200, I'll give you the number. So 200 documented cases actually happening at the schools. So are the schools the cause, or are the schools just a worry? I mean, it seems like a very small number.
The data shows you don't need a large number to cause a lot of spread. I forget the actual numbers, but it really just takes a single person to have a large spread of the virus if we're not following the requests of the social distancing and the mask wearing. So I would not focus so much on a number in a particular place, but the overall what's going on in the community, what's going on in our hospitals. All of that together guides what we need to do. And I will tell you, the numbers are going up, the hospitalizations are going up. That's what I'm worried about.
One last thing on the schools, and then we'll move forward. I heard a report in the media today, and I wasn't able to look it up myself, but it was a credible media organization saying that there have been more teen school-age suicides this year than COVID deaths, and that number appears to be increasing as well. Is it worth looking at the overall health of these students in terms of mental health and emotional health, as well as the COVID?
Absolutely. And I think that's the one thing we talk about but don't really focus a lot on, which we should, is the mental health to all of this. There is a mental health part of being locked down in your home if you can't go and interact with your friends at school. It's the same for the adults. We have to look at this at the whole person, not just on the disease. So I think it's important to understand what those ramifications are because of what we have to do based on COVID. They're absolutely linked, and we need to make sure we have resources available to address those issues.
All right, I've got 1 minute left and 2 questions. Number one, quickly, how are your hospitals looking right now?
Our numbers are going up. I cannot emphasize to everyone enough, they need to please follow these directions about mask wearing, social distancing. It's on every single person to help stop another surge. There are no resources across the country available if we have a really massive surge again. We will be on our own most likely. So we really have limited resources. I need everyone to please do their part and protect each other, including themselves.
Last question. I have Dr. Kara Christ coming on in our next hour. If you were going to ask a question of Dr. Christ, what would you ask her right now?
Just again, what's the upcoming strategy? I have asked that of her, and she's always been willing and able to talk. She has a huge job in front of her. I don't envy the position she's in because there's a lot of hard decisions that need to be made. I've commended her ability to really listen to all of our input. And again, just to be flexible with the data. As data changes, we just need to change our strategy.
Dr. Goldberg, always great talking with you. Thank you for all you and your team are doing in our community right now. And thank you for taking the time to speak with us today on AZAM. We'll see you next week.
See you next week.
All right.